All right. This is Elizabeth, the Chief Program Officer here at the Coalition. We're going to go ahead and get started with our weekly webinar provider conference call. So I'm once again going to ask the staff in the room to go ahead and introduce themselves. Thank you, everybody, for joining us.
Hi, everyone. This is Scott Stevenson, the Quality Director.
Good afternoon. This is Mercy Easter, Business Information Director.
Deanna Johnson, Chief Finance Officer.
And this is Roseanne Fricks, the CEO here at the Coalition. And I would just like to thank all of you for continuing to be part of our journey as we learn together going through COVID-19. We do appreciate you, and I hope that you realize that and understand that. And sometimes we don't have all the answers at the moment, but we definitely are interested in getting answers to meet everybody's needs. So bear with us. We appreciate your patience as well as all that you're doing for our kids. And I'm going to turn it back over to Elizabeth.
Thank you. So as we've done in the past, I'm going to just go through our agenda. The agenda is available in the participant box, I believe, as well as the other attachments that were in the email sent to you earlier today, as well as yesterday. So I'm going to try to answer some questions that we've already been given. So let's see if I can answer them before you ask them today. Last Tuesday, we kicked off our first responder. Okay, let me tongue tie. Back up. First responder essential medical personnel child care services. We kicked off this program last Tuesday, and it went statewide. Marion County has gotten an extremely strong response from people working in this industry. So what that means is through the Office of Early Learning, the Department of Education, and all the early learning coalitions across the state, we are supporting the first responders and essential medical personnel by paying for their child care services so that they can continue to work. The providers that are participating in this are our contracted school readiness providers. So we'd like to thank those of you that weren't contracted that have recently joined us again to assist these families, because this is a great need. And we have seen a huge response to this service already, with receiving more than 200 phone calls to the Coalition. And we have about 180 applications waiting to be processed right now. So what I want to do is kind of give you a little bit of information of what this program looks like. In the email that I sent yesterday, I've actually been sending this particular attachment for a little while, and it's one that's up on your screen right now. It is the how to complete and submit the child care application and authorization form. So this is a statewide document. We added our contact information down at the bottom. Right now, I am the contact for this, and Latricia Sims is the other main contact for this, but we have a whole team working behind the scenes to process referrals for these first responder and essential medical personnel families. That being said, the process, what it looks like is when a person calls of interest, we've been really good, by the way, at getting the word out about this. Our response has just been phenomenal and very positive. So we are talking through to each parent that calls. Of course, we're asking for their patience because so many are calling right now, but we are describing the school readiness program to the parent, and then we're walking them through the process of applying on our website for the school readiness program. So they would go and apply basically for our wait list as the front door to services. And once they apply from that, we're taking their application and we're populating a referral that we then will send to each HR department for their individual employers. The HR department then goes over the information on the referral, confirms it. Sometimes they're able to get the family member to sign it if they're working in the same building. If not, we just ask them to return it back to our office so that we can finish processing the enrollment to you then. The parent would go in and finish their enrollment application, and you would see that child then become enrolled on your school readiness attendance document. So it's just like when you enroll any other school readiness child into your program. from there, you'll be able to claim your attendance like you normally would. You will definitely want to keep a sign in and out sheet like you already are. And you would get reimbursed with your school readiness payment just like you currently do for these children. So I want to move over to another question that was asked of me yesterday. Okay, so what's the time frame for this? Each parent that applies will receive the referral from April 1st to June 30th. So the referral is valid from April 1st, which is retroactive, to June 30th. And I know some of you are saying, well, what if parents already paid? So if parents already paid, we're letting them know that they can have that discussion with you about what that's going to look like once the school readiness services kick in for that family. So that is a business decision that you want to make to decide how you want to handle payments that you've already received. So your next question is going to be, well, what are you going to pay me? What we're going to pay you is the market rate. I attached our current market rate to the email I sent out today. And the market rate is the maximum rate we are allowed to pay you. It is the rate that's currently in your school readiness contract. And it's the rate that you'll see in front of you. And it's based on the child's age and the type of child care provider you are. So if you look at that rate sheet, and Marcy's put it up on the screen for you. So that rate sheet, it goes right down, full or part-time care. We determine eligibility based on the parent's work schedule as well, just like we do any other time. So full and part-time care will be taken into consideration, and that will be listed on the parent certificate that you'll see in EFS mod. Okay. The next thing you see is the rates broken down by age. And remember, our market rate sheet here is a daily rate. So you'll want to multiply that by 5 or by however many days you're open in the work week. Trying to see what else. So then you look over at the columns, and the rates do vary depending on the type of provider you are. So if you're licensed or license exempt, or if you're Gold Seal, or if you are a licensed family child care home, then you'll see those different rates. This should look pretty familiar to most of you. The other piece that is not covered, so we are not able to cover registration fees, and we're not able to cover differentials, and we're not able to cover any of the additional fees that you might charge on a typical day to the public that walk in to ask you about child care services. So you'll want to make sure, and we are telling parents that they may be responsible for a differential fee due to you on a weekly basis or however you charge it, and they may be responsible for a registration fee if they're enrolling with you as a brand new enrollment. So that is something that we are letting the parents know right away. All the rest of what you do as a child care provider should be listed in your parent handbook. And that is something that you should give to the parents. I'm encouraging parents to ask questions if they've never enrolled with you before. We are going back to the checklist for quality child care. So we're telling them they should be calling you and asking questions because we want them to be just as comfortable enrolling with you as you are with taking on new students and new children in your classrooms. Some of the things to think about when parents call, do you have the ability to do a virtual tour of your site? Can you walk them around? Can you post some pictures or guide them to your Facebook page where they can virtually see the inside of your program before they come over? Another thing that I'm telling parents as we're talking to them is be prepared to not be allowed in the building. That's something right now. With the new CDC guidelines, a lot of you are being really cautious, and we encourage that. And you're not letting other people come walking through the building. And we're trying to prepare parents for that as well, that they may be stopped at the door, that they're going to be asked to wash their hands, to sanitize their hands. If they are needing to come into the building, you may be asking them to put foot covers on. That's a new thing that I heard about. So you might be asking them to put gloves on, wear a mask, and you have the right to do that, by the way. Anybody that needs to come into the building, you can provide them with a mask if you have one. You can ask them to wear their own. You can ask them to take those extra precautions because you are doing the same thing. Let me pause for just a second and see if I covered most of your questions. There's not a lot of questions up there, so give us just a second to look. All right, so I either did really, really good or I talked really fast and you don't know what questions to ask yet because we only got one question about whether we're covering 100% of the fees. And let me just reiterate what's happening with that. We're covering the market rate. So the market rate typically is a combination of the parent fee and what we can pay, the maximum amount that the coalition can pay. So that market rate is up on your screen right now, and it's attached to the email that I sent earlier. So you can feel free to go back to that. Now, there is a special program that we have a partnership through Advent Health for. This is only in Marion County right now that we know of. Advent Health would have it in other counties, and they will initiate it on their own in other counties. So please know that when I'm talking about programs here in this partnership, this is for Marion County. So Advent Health is supporting their staff with their own child care application. And if your parents are Advent Health parents, they are going to help cover some of those differential fees that we are not allowed to pay. So the parent, you want to encourage them to go to Advent Health, to their HR department there, and ask for the child care application. The other side of that is if you do have a parent that applies through Advent Health, the coalition, we're going to be reaching out to you with one additional document because we want you to give us what the differential fees are that you're charging to those parents so that we can connect with Advent Health and get those fees paid. I'm seeing a couple questions pop in, so let's see if we can get some answers to you.
The first one is, what funding category are they being enrolled into?
So there is a special funding category for this particular program. So
the funding category will be a BG1 with an ESS code.
So it's a BG1 with an ESS code, and all of these families are going to have a referral. So they're all going to be under that BG1 ESS for essential services. I just had something else for that too, and now I lost it. I'll think of it eventually. I'll think of it. Oh, that's what I wanted to say. Your currently enrolled school readiness families that fall under this category, we are going to be transitioning them over to this BG1 ESS through June 30th, even though it doesn't really change what their services look like right now because we are already covering their parent fees. We're already covering the market rate, of course. So that's not going to change for them, but you will see us moving them over to the BG1 ESS code because the state OEL and we need to track how many people we're serving through this particular program.
Okay, the next question is, can you become a registered provider and get paid as much as others for the first responders?
No. The answer to that is no. And then right now, the coalition does not contract with registered child care providers. We need all of our providers to be licensed through DCF. There is regulation through that, and there's a health and safety standard as well as insurance regulations that, to be quite honest, it doesn't benefit a registered provider to contract with us financially right now. You'd be paying more out in your insurance premiums and some other things that you have to purchase in order to meet the health and safety requirements. If you are a registered provider, we have been working with DCF very closely to see about getting the licensing completed for those of you that might be interested. We don't have very many, I'll be honest with you, that's interested in school readiness services who are registered.
So no need to report absences as they are BG1 funded child. You should always be reporting all absences. We will still pay those absences with the guidance you have already received for March, but you should be recording all absences always.
And the second part to that question is, I think you might be referring to whether you need to contact a case manager or something to that effect because of the high risk that BG1 children often come with. If it says Ryla Wilson on your certificate, you definitely still need to follow those protocols. As far as reporting absences, multiple absences in a row, which is something that's in your contract that I think you're referring to maybe as well, you do want to still follow that piece. But if you're in contact with the family, especially first responder families, which often work 12-hour shifts only 3 days a week, there's going to be days out of the week where you won't see that child. If you understand the parent's schedule, you don't have to do anything special. You would just claim that absence on your attendance roster like you typically would. So in other words, you just want to follow the same protocols you typically would for reporting excessive absences, but do log them on your attendance roster. And if it's Ryla Wilson, you definitely need to get in contact with the case manager. Most of these particular families, though, are not going to have a case manager. Their case manager is going to be their HR department because that's where the referral is coming from. So that's different.
We're going to go into a couple of the other ones. And any of the answers that you see coming up on your screen next to you, if they need to be, Elizabeth will review them and make sure she puts extra details in them if they warrant it.
Right, and we'll be updating our frequently asked questions list, which is actually growing. Scott has been helping me, Marcy's helping me, so we're taking a team approach to try to answer your questions quickly. But keep looking at those, and Scott has been organizing it so by date, so he ends up putting like a little new tab, or a new row in there that says these are the questions that were asked on this day, so that you can find the answers from today.
Okay, so the next question is there any way that ELC can provide those market rate funds at the beginning of the month or the beginning of each week, since it directly impacts the weekly cash flow of providers that are open?
So we have been thinking about this, and people have been asking this question. Give us just a second. All right, so for that, we have been talking about this, and we've been listening to the providers who have been sharing this issue with us. So we are trying to look at different opportunities for this. So let us continue looking at options and get back to you on that answer. But this is a priority for us, so we'll definitely be looking further into it.
Do we lose class differential on students that are BG1 ESS?
If you have a class differential tied to your contract already, it would fall into the same category as your current market rates do. So it wouldn't have an impact. It wouldn't change anything. It would be an additional enrollment at your site. So if you have a class differential tied to your contract already, you'll still continue to see that differential in your payment.
I am scheduled to reopen on Monday, the 20th. Is there anything particular I need to do?
Just actually open and let me know that you are open. And actually one of our staff, our quality staff, are contacting you Monday, Wednesday, and Friday now to follow up and just do those well call checks. But do let us know when you're open, because I'd like to add you to the provider list, which is actually, this is a great segue for me to talk about that provider list. I have updated, now let me give a little PSA here, public service announcement about this list. This list is not generated through our CCR&R services. Our CCR&R services are still fully available to any parent that needs them, and those services generate random referrals that are geared specifically towards each family's individual needs. So it's very personalized when they get it. This particular list is like the down and dirty. It is the childcare name, what kind of program they are, license status, address, phone number, and the services offered. And I have been able to kind of delineate to make it a little easier. Those of you that offer night care, weekend care, 24 hours. And we're still encouraging, of course, parents to call you ahead of time and do that kind of virtual tour, ask those questions, and get all the information that they need before they make an informed decision about enrolling their child with you. And to find out if you have openings, because we also don't want them to just assume that you have an opening. We need them to know and be comfortable with it. So this list that I'm sending out are the current open school readiness providers. So I've gotten a few emails from people saying, I'm not on your list, and they're correct. They're not on my list because they're either a VPK only provider, which if you're VPK only and you want to do school readiness, even if it's only through June 30th, you should join us or think about joining us, because the parents that are enrolled with you currently, they need you. So if you're a VPK only provider or you've chosen to close your doors right now, you are not going to be on this list, because it doesn't do us any good to send this list out to parents who are trying to research childcare providers if you're not open. So that being said, consider reopening if you're closed, and if you're a VPK only provider, I would highly encourage you to think about coming into a contract with us, even if it's only through June 30th, especially with the ASQ requirement and the class observation requirement waived at this time. It would really only benefit the parents, especially since you're already open.
Okay, has there been any directives from any state agency that mandates staff to wear masks at work?
No, the CDC has just changed the recommendation to encourage people to wear masks when they're in public places, because they are just, it's kind of common sense. The less commingling of our germs and breaths that we do, the less of a chance you have of getting that virus. So it's just a safety precaution. It is not mandated. Let me add a little to that question though. Last week I had the question about, what about outdoors? Do we have to follow the CDC group guidelines when we're outside? The answer is yes, you should follow the CDC guidelines whether you're inside or outside. But the difference with outside is, and you don't want to commingle groups of children because their immunities have already commingled together. So we don't want to introduce different groups of children to each other that haven't been exposed to each other before. And the other thing is, between groups, you want to do a quick sweep and wipe down the playground equipment. So grab one of those wipes, grab some cleaner spray and a paper towel, and just do a really quick wipe down before you let children who haven't been exposed to each other play on the same equipment. So that's recommended. Same thing with the masks. Last week, provider shared with us that they're sewing their own masks, and they're actually giving them to first responders. As they're sewing more and more, we sent the pattern out. There's a lot of great options for mask coverings, but it is not required. It's recommended.
What happened to the VPK summer program?
Nothing has happened to the VPK summer program yet. We actually are going to talk about VPK in a few minutes at the bottom of our agenda. So right now, nothing has happened to it.
Next question, how does someone find your provider list? Is it on the website?
It is not on the website. I'm actually sending it to parents individually as they tell us that they do not have a provider. So one thing I can share with you is I literally can count on, so now if I take off my shoes, I can count on my toes and my hands the number of parents that are not currently enrolled in childcare who are asking us for services. So a big majority of the parents that are calling us are already enrolled at one of your sites. So how you can get the list is if you're on my, if you get my emails every day, or actually I'm moving that to 3 times a week, I've sent it out yesterday and I sent it out Friday and updated it daily as providers are saying, wait, I'm not on the list. And I verify, like I was able to add some of our out-of-county providers because that's important. We have parents that are working in hospitals and other places that are not in Marion County, but they're Marion County residents, and they're attending providers that are contracted with us. So we were able to add some of you back on there. If you're not getting my e-blast, let one of our team know, and we'll add you to the list.
DOH has suggested that all child care workers should be tested. Is Marion County DOH going to provide that service for our centers?
That is not something we've heard. So I would be very interested in whoever wrote that to talk to you and find out where you got that information from so we can follow up on it appropriately. And we have very good relationship with our Department of Health here locally, so we'll be very happy to follow up on that.
Hey, Pastor, this is Roseanne. Why don't you email that information to me and I'll follow up on it directly. Thank you.
There you go.
Will Marion County ELC open up the opportunity for funding for other essential workers,
So
care workers?
we have had this inquiry by other essential workers, not just child care staff. We've had some of your staff calling us too, saying, I am a first responder, which, you know what, we agree. And we're in the same boat as you are. We're not first responders and we're not essential medical personnel, but we are essential workers, which is why we're still here with you, alongside with you. We can't make that decision. That has to be a directive given to us from Office of Early Learning. And what we're doing is we're encouraging those people to go ahead and apply on our wait list so that we already have an application on file for them. But right now we can't make a decision on that. It's beyond our ability.
And going.
All right, so right now that's the end of the questions for our first piece on our agenda. So thank you. You can continue to add questions if you need to. And again, we'll update these frequently asked questions and send them out with our update probably tomorrow, Monday, Wednesday, Friday. We're doing our COVID updates now. The next thing on our agenda is clarification for ASQ requirements. Scott and I had a very lengthy conversation yesterday, and last week the question was asked. I'm still getting, somebody put up there, I'm still getting requests to complete ASQs. Why? So just to provide a little bit of clarification for you, the D-Day for this pandemic was March 15th, 16th? 16th. It was a Monday. So it started earlier, but our date is March 16th. So any enrollments that you had for school readiness prior to March 16th, and you have that 45-day window to complete the ages and stages questionnaire, those are still due. So we are still following up to ensure that you are meeting that requirement. So the ASQ, just to sum it up, the ASQ at anything from March 16th until June 30th at this point, those due dates are waived. You're not held responsible for doing the ages and stages questionnaire on those school readiness students or any of these ones that we're enrolling now. You can, if you want to, you can do it, and the opportunity is still available. You still have access to the website. But any enrollments prior to March 16th, you are still responsible for completing those ages and stages questionnaires within that 45-day window. Now, we're almost to the 45-day window for some of those. And I know you're going, well, what if I'm closed? What if I don't have the child anymore? What if the parent stopped bringing the child? If any of those scenarios fall under your category or are a worry for you in meeting this, that's okay. We just need to know that. So when VidMary's asking you for this ages and stages questionnaire, you can respond and say, I'm not going to have that for this child because, and tell us why, so that we can document it. Because I can tell you the Office of Early Learning is going to be looking for us to meet those requirements, and we still have to meet anything prior to March 16th. I'm going to pause for a second and see, I see a question just popped up.
As far as the first responders, how will we do sign in and out if they would start in the middle of the month and we would get paid starting from April 1st?
So the referral does start April 1st. So basically, just like you've gotten paid, let's think back to how it worked for March. You got paid for all enrollments for the whole month of March, even though this really didn't start until March 16th. So when you think about that and take that in the terms of these first responders starting in mid-April now, you're going to get paid for their enrollment if they were enrolled with you from April 1st through the entire, whatever their enrollment extends to. So if they were enrolled with you as of April 1st, which a majority of these have been from what we can tell, then you will get paid from us for that date. If they enroll with you tomorrow, then you'll get paid starting tomorrow. So it's as of the date that they were enrolled with you, not going back any further than April 1st. I hope that makes sense. And for your sign in and out sheets, you're just going to create that sign in and out sheet. If they start in the middle of the month, you can put a note at the top of it that says they were enrolled. And actually, if they were already enrolled with you, you should already have that sign in and out sheet. So you can carry that on from their private pay, carry it over, or attach it to the new sign in and out sheet if you choose to create one. Okay, let's look and see. I think there's one more question.
What if the child was out before March 16th?
What if the child was out? So I'm guessing that's about ASQ. If the child was out before March 16th, then you just need to let us know that you were not able to complete that ASQ in a timely manner because the child didn't come back. Okay. All right. It looks like we're caught up on questions. All right. The third agenda, I'm going to stop talking and Scott's going to entertain you for just a second about this. This is really cool.
Hi, everyone. I wanted to talk to you a little bit about supplies and y'all's needs of supplies. So every Monday, Wednesday, and Friday, the quality team gives you guys a call. And from the beginning, I think they were asking if you're open, how many transfers you can take, how many first responders you serve, and any needs or supplies that you might have. So the good news is that we have some supplies in stock, plenty of paper supplies, plenty of paper products, but very limited cleaning supplies. So the way we're handling this is that if you are an open provider, we will be reaching out to you if we have not already to kind of confirm the notes that we have for you based on the needs that you express to our staff, and setting up a time for you to come by the office to pick those up. So as of today, I think at noon, a couple of our staff, it was either Susan or Destiny, may have called you and asked you, are these the supplies that you need, and tried to set up a time. So if you have not received that call, you will be getting that call shortly. So again, the good news is lots of paper products, 1,400 rolls of toilet paper, I think, and over 400 paper towels. So there's no shortage there. We can get everybody that if you're in need. But just do keep in mind that the cleaning supplies are limited. But we want you to continue to tell our folks on the Monday, Wednesday, and Friday calls what your needs are. There's still a possibility we can get some of these things. It's just like everybody, it's not easy to come by. So if I'm not mistaken, there were about 57, give or take, providers who were open. And during the calls, I think about 35 to 40 of you expressed a need or some supplies. So if you are not being called and you think that you do need supplies and you're open, please let our staff know tomorrow morning when they reach out to you on their Wednesday calls, and we'll follow up with that. So that being said, let me pause here a moment and see if we have any questions about those supplies. Oh, one other thing is that the folks who were called today, they were setting up times for Thursday. So that would be the day to come by the office to pick it up. And we're trying to kind of space it out in 10-minute intervals so that we do our social distancing.
Yes, contactless pickup.
And this is Roseanne again. And real quick, when the team here at the Coalition calls you, it is real important that you do let us know what you need, because we are asked throughout the community. In fact, this afternoon at 2:30, Elizabeth and I have been asked to share what do you need. So if you don't tell us, I can't even go out to the community and tell the community. So please make sure you share those needs with us, because you really are not in this alone. We are right here, and we need open communication to make sure this works for all of us. Thanks. Marcia, you got a couple questions?
Will you get gloves?
Okay, gloves is one of the pieces that we do have. They are very limited, but we do have some gloves.
We're still looking for them, so we'll keep looking for them as long as you're expressing a need.
Do you have any hand sanitizer?
Unfortunately, no, we don't. Not at this time.
And we'll keep looking for that too.
Are those, Scott, are those two big needs that
Yeah.
you're hearing from?
Yeah, the hand sanitizer and I think the Clorox wipes, those were two that we don't have that are a big need.
Okay, that's it for the cleaning supplies.
All right, so the next thing is a VPK update. We just want to kind of touch base on what's going on with the VPK program. We are accepting applications for certificates of eligibility through with parents. So parents are able to log on and get their certificate of eligibility for next program year, which is program year 2021. And those that are, we're still giving applications for the summer program, because right now, let's just take a leap of faith. Like, we're going to have summer VPK. If you're a provider that wants to do summer VPK, right now, we have not been given any directives to say don't enroll new providers, don't sign them up. So if you're interested, you can go ahead and fill out your application for, well, most of you already have an application. I'm going to tell you, reach out to Scott if you're interested in offering summer VPK, and we'll take it provider by provider to get your applications finalized and your classroom set up so that you can start enrolling students. If you're still planning on staying open, which we encourage you to do so. For improvement plans. Improvement plans for VPK providers on probation are still due. So while we can work with you on executing your improvement plan, and we do have staff available to support you through creating it, and Scott and his team have been working with providers already to get that done, we do need those created and submitted.
Can I speak to that just a moment? So I believe we had 42 providers who are currently on probation. Looking in the system, it looked like there were 7 who have a pending improvement plan. So that leaves 35 who have not. It was in the webinars that we did back in February, but I just wanted to reiterate that the improvement plans must be submitted by all providers within 30 days of you starting your new VPK contract. So for most of you, if I'm not mistaken, that would be July 1. So that means all improvement plans, the deadline date for that would be pretty much May 30th. So if you're having trouble with this, please reach out to us. It is something that the coalition needs to review and approve. So we need to allow a little time for that as well. We would encourage you, though, just to go in the system. What we saw on our webinar from OEL was that it's pretty simple, and me and my team actually sat down with one of the providers and went through it. If you have not done that, I encourage you to go in the system and just start kind of navigating through it. And if you have any questions, you can call myself or anybody on the quality team, and we can help you out. But it was just a reminder, with things going so fast and the weeks flying by, May 30th will be here before you know it.
Perfect, thank you. Question.
So someone needs a little bit more clarification on, it says My understanding, normally SR pays after the child's first day of attendance, but now SR will cover the whole month. Is this a new policy, only first responders for everybody? If the child is already in attendance at your site and is a private pay, we can cover as of
April 1st, as long as they were enrolled.
With your site as a private pay, we can cover from April 1st. If the child transfers to your sites or enrolls, example, as of April 13th, we would start paying either April 13th, if that's the first physical day of attendance. So that rule still applies. The change is if they were private pay already enrolled at your site, we can cover those effective April 1st.
And let me add a second part to that answer. The other caveat to that is that you have to have been contracted with us. So, for example, we have a provider that just started their contract yesterday. Their enrollment will be effective yesterday on April 13th. So we can't go back if you weren't contracted with us, but we can move forward from the day you contracted with us as long as those children were enrolled. So let's see, it looks like we may have one more question up there. Scott, can you see that question?
For now, can we just choose the option for now? We are working on the plans, but due to our current situation, it is difficult to complete the training with the center directors.
Right. So your improvement plan, if you're choosing professional development with your team, there's going to be a time period that you can have that training occur. And it's also, this is a really good time to test out doing online training and doing some other components, reaching out to the training facilities that you're interested in and seeing what opportunities do they have for online training right now for your team so that you can meet some of those requirements. This is a great time for that. There's a lot of conferences that are moving to online platforms. There's a lot of different things that are moving to virtual enrollment. My kindergartner is doing Zoom calls right now. So we're all working differently to still meet the requirements that we are responsible for. We cover them all?
That is all the questions.
Okay. And
hold on. Do you find out if we get the in-service hours from those websites?
From these webinars.
For these webinars, yes. BCF was very gracious and said that yes, as long as we can provide you with a certificate. So Scott's quality team is working on getting everybody that have logged on from all of our calls in the past. They're going to create certificates and send them via email, I believe, to everybody. So Scott's nodding at me when I said that. So yes, we are getting certificates for everybody that has participated on our calls here. And the last thing under VPK update for our call, since we are coming to an end for our hour of time together, is kindergarten readiness rates for the program year VPK 1920. There will be none. OEL did release that information last Friday. Our team, we get to participate with Roseanne. She lets us sit in on the call so that we're just as informed as she is on some of the directives that comes down from OEL. So we're appreciative of that, but we can definitely share with you there will be no kindergarten readiness rates for the program year 1920. So as we get more information on that, I can't really answer many questions about that, about what does that mean, what does that look like, what does that mean to providers on probation. The answer is we don't know yet. So hang tight on that, but we wanted to just let you know as we receive information, we want to make sure you have it as soon as possible. So we're just going to look for a few more minutes and see if there is any additional questions popping in that we can answer, and then we're going to wrap up our call. Marcy did put a poll out in I think it's in the menu bar, it will be in just a minute, asking if weekly, it's a blue box, it's pretty cute actually. How often would you like to have these provider meetings, weekly, every other week? We want to make sure we're using and respecting your time wisely and just being really cautious about how much information we throw at you. So while we were really throwing a lot of stuff during the first couple weeks that we were impacted by COVID-19, the new information has kind of slowed down, and programs are kicking up to come in to relieve some of what's going on. So we want to make sure that you are getting what you need. So please do participate in that poll. Let us know if you want these weekly webinar calls or if you'd like to go bi-weekly. And let's see if we have any questions.
Okay, so we've got a few while everybody's answering their poll. For clarification, ELC will pay for private pay clients as long as the site has contracted with ELC.
For school readiness, yes.
For the ELC will pay for the first responders, medical personnel that have reached out to us to complete the referral process.
Oh yeah, they have to be enrolled in the program. So you have to have them as a school readiness client. Yes, but you do have to be contracted with us as a school readiness provider. And if you are not a school readiness provider, we would love to work with you to get you contracted, even if it's only through June 30th. And the clients do have to go through the school readiness enrollment process.
Okay, so that was kind of two of the same questions that I think that we've answered. Thank you for being informative, keeping us informed, and passing information out to us.
You're welcome.
Do we have to contact someone to get the in-service hours?
No, Marcy is able to pull up everybody who logs on to the call, and she is giving that information over to Scott, who is giving it out to his staff so they can create your certificate. We're working on that as fast as we can. Believe it or not, a lot of you joined this call, and we're super grateful for that. So it's a lot of certificates to create. We want to keep doing that.
Okay. We've had as high as 90. What happens with the VPK readiness rate for 18-19 and the purchase of new curriculum?
So we are still waiting for some guidance on that. If you choose to purchase a new curriculum as your response to your provider, your improvement plan, then that is your responsibility. Do know that you'll have to provide us with a receipt of purchase, and you'll have to show us where your staff participated in training on how to implement the new curriculum. But as far as what happens with it, if that's the choice that you make as a response to your improvement plan, then that's what happens with it. You're choosing that.
I'm going to go ahead. Is anybody else needing to vote? We've got about 69% that have voted at this moment. We'll give it just another few moments while we ask or answer a couple more questions. My current curriculum is no longer on the list.
If your current curriculum is no longer on the list and you're a provider on probation, you have a couple options. You can either choose to purchase a new curriculum that is on the list, or you can go with the staff development plan.
What if you're not able, or what if you are not on probation?
Then awesome. Good job. We want you to continue to do what you're doing and move forward. If you're not on probation, you don't have to do an improvement plan.
Does it matter where you purchase the new curriculum?
It doesn't matter to us as long as it is a legit copy of the curriculum, and you will have to provide a receipt of purchase. We don't, no counterfeit curriculum going on here.
When you go, if you make that selection on your improvement plan, when you click on it, it'll take you to the OEL website and the different curriculums that you can choose from. You just need to make sure that it's the most, what do they call it, recent, current, series, To renew your SR 2021 profile, how many selected holidays can we choose?
So, we can answer that. Go ahead.
When you do your calendars, you need to put every single closure date that you're going to have for the year. We at the coalition have already selected 6 days, so we will reimburse you for up to 10 holidays. Now, off the top of my head, but those I sent everyone an email out maybe a month and a half ago that has those 6 holidays listed. So you can pick the other 4 days. So just know that up to 10 days, the coalition will pay for those 6 holidays that we've already selected, plus 4 additional ones. Anything you choose to close beyond those 10, the coalition will not pay for.
There's some questions that we need to reach out to individually. So we will, if you've marked a question and we haven't answered it, we'll come back and have somebody reach out to you individually. The curriculum is no longer on the list, so even if you are not on probation, we still have to choose a new curriculum.
If you're talking about VPK, that is not the case. VPK, as long as you're not a provider on probation that chooses that curriculum piece, you can choose to implement any curriculum you want that's developmentally appropriate. Only for school readiness do you have to have an approved curriculum for all ages that you're serving, birth through 5.
Okay. We've got about 87% of the vote. I'm going to go ahead and close that out.
Thank you for participating.
And just so everybody knows, 70% chooses to have this continue weekly.
Aw, we love you too.
Okay, the next question is going to be, if the first responder private pay was already enrolled but went on vacation for spring break, would you still pay starting April 1st?
So spring break was in March for Marion County and also ended in March. So we would still pay from April 1st on. Now, I know that some schools, like private schools, may have a spring break happening in April, but if they were enrolled at your site, we would pay you according to their enrollment, just like we did for March. Regardless of attendance, you'll get paid for everybody enrolled.
Okay. So I think this is kind of a two-part. It says, I'll read them together.
Okay.
If your curriculum is no longer on the list and you're not on probation, and many of those on the new list, many are not available unless you are in a system. And then the next one, did you see the cost of those curriculums and the availability of them?
Oh yeah, they're costly, which is why OEL has given another opportunity to use a staff development plan instead of purchasing curriculum. They're costly and they can be hard to acquire, some of them. And so I know that previous portion of that question said basically it's for a system. I'm not really sure what you mean by that, unless you're meaning like themes or units or like an entire program. I'm not sure what you mean by that, but yes, we're very well aware of the cost of that, and we're keeping an eye on it actually for our school readiness providers who may have a challenge with curriculum this year. But for VPK providers, you do have a choice. So you just have to know what all your options are and make an informed decision. And sometimes though, if something's not working, it might be time to either get another training on that curriculum and brush up your staff on how to use it, because most of you are using a developmentally appropriate curriculum, and maybe that your staff don't quite understand how to implement it in a classroom or what that should look like. Our quality team can help. We have staff that can help research how to implement curriculum and what that means for you. So please, if you're having a problem with that, let Scott know. Reach out to any of our quality team. Lily, Tiffany, Sienna, Mary, VidMary, they're all able to help give you some guidance on how to implement a curriculum within a classroom.
Okay, back to first responders.
Okay.
How long is it taking for the first responders and essential workers to get approved for school readiness?
So that's a hard question to answer, and I don't know that there is an actual answer to it, except for we're doing it as fast as we can. We have the process itself. It takes us probably at least 20 minutes per parent to even complete the referral and get it over to HR. So because there's so many facets involved, so the family has to fill out the waitlist application. Then our staff go in immediately and put that application into coalition reviewing and complete the referral form, and then we send it over to the HR department of that individual employer. Once that happens, it's in the hands of the employer to get that referral back to us, and our staff are standing by basically to process those referrals as soon as they come in. So there's a lot of moving parts to this, and we are getting through them as quickly as we can. But remember, if they were already enrolled with you, it goes back to April 1st as long as you were contracted, or to the date that you started contracting with us as long as they were enrolled. So it's not taking us a super long time, but I do want you to keep in mind that we have 180 applications. So, and these are all new parents that we're walking through this process. So please encourage them to be patient. We're returning phone calls as soon as we can, and into the evening hours, after hours, before hours, 1 o'clock in the morning. I mean, we're doing the best that we can to get that process quickly and timely. So just keep looking for you to be able to accept those enrollments in EFS Mod. We're looking at the last question now, and then we're going to tell everybody to have a great afternoon and stay safe.
Will the private pay parent make you over ratio on paper?
There is not a paper ratio. So what you're getting at is if you put a private pay parent into your school readiness program and it takes up a slot in your program for a child that may not be attending right then, you need to follow the CDC guidelines. That is a requirement if you're remaining open right now. DCF is looking and enforcing that. 10 people to a space, and that includes your teacher. So if you have 2 teachers, you can have 8 students in that space or that classroom, that defined area. So on paper, let me give you an example. I have we have family childcare homes that can have no more than 11 children on site at any given moment, no matter what the ages are. On paper, they might have 25 kids enrolled. And how that happens is because none of the kids attend the site physically at the same time. So they still remain in ratio. The ratio is followed by the actual number of students of children that are there. And I don't know, I couldn't tell if Avita or anybody from DCF was able to join us, but if they are here, you feel free to add to that if you have anything you want to clarify.
There's Avita. Avita, I'm taking you off mute.
Just in case you want to say anything, you're free to speak.
Yes, hi. What was the question again? I'm sorry.
It was, the provider was asking if they enroll a private pay child into their class, will it put them out of ratio on paper? And my answer to that was no, that ratio is defined by the number of students or children in the classroom at the time, physically there.
All right. Yeah, that's true. They can have as many children as they want enrolled, except, when they are actually in the classroom, they have to meet the capacity that the state gave them, and they have to meet the ratio capacity in the classroom and the DCF regulations. So if the capacity in the classroom they have for 15 children, right now they cannot have 15 children. They have to abide by the CDC. So including the teacher and the children, they need to have 10. If the capacity of the whole center is 50 50 in total. They have to have that capacity at all times, with the exception, of course, of the CDC recommendations. But they could have as many children enrolled. They just cannot have them all at one time.
Thank you very much. We appreciate that.
You're welcome.
And with that, I don't see any more questions. So we are going to get working on this frequently asked questions. I'm going to look around the room, see if anybody in here wants to add anything. Everybody good? Please stay safe. Continue to stay home when you're not at work, and follow all those cleaning procedures. And we apparently are going to be doing this call weekly. So thank you for participating in our poll. And look for your updates and stay in touch. Have a great afternoon, everybody. Thank you.